thank you all for being here. Today, we're going to talk about everything that's going on with Omicron, with the major CDC changes that came last week, with the OSHA ETS and more. We are joined today by Roslyn Stone from 0 Hour Health and Michelle Harden from Messner Reeves. We are so excited to have you both here. Thank you for being here. We're gonna get started with Roslyn. So we're gonna start with Roslyn giving us some updates about what the heck is going on with all of this, all these variants, CDC changes, things like that. And then we'll move over to Michelle to talk a little bit about OSHA, the Supreme Court, and all of these big question marks that we will hopefully learn more about today and tomorrow. So Roslyn, would you like to kick us off? Oh, Roslyn, you're still muted.
Thank you. Thank you very much. And Jen, thank you for the intro. And I think that, if you're not confused, you're not paying attention is probably the best line I've heard all week. And Michelle, it is lovely to talk to you at not 5:30 a.m. Mountain Time, which is when we usually find the time in this mess to talk to each other. It has certainly been quite the last week and a half. The week last week started out with the CDC issuing new guidance, and we'll get to that in just a minute. But the story of the week this week really is the massive rise in cases. We heard about Omicron, we knew it was coming. We heard there could be 1 million cases a day, and that sounded sounded insane when we first heard it, but here we are. And yesterday they're reporting 586,000 lab reported or clinic reported cases. Our estimate is the real numbers are 10 or more times that, because all of the rapid tests, home tests are not being reported through those numbers. And some of the clinics and labs are so overwhelmed that they're not turning their data in, and their data may in fact have a 3-week lag. So it is really a pretty modest estimate that we're seeing 5 or 10 million new cases a day. That may in fact be good news, and we're burning through this really quickly. Personally, I know more people that are sick today than cumulatively to this point in COVID. Amongst our 0 Hour Health Zedic family, amongst my personal family and friends. We don't yet see it abating. We were hoping that by yesterday or today we would start to see a little bit of a downturn. We have not. We peaked as a business in managing this last Thursday, which was the 30th. To give it some context, before the surge started, our nursing team was chatting with 700 or 800 of your employees, or many of your employees a day, who were excluded from work for symptoms or illness. On Thursday, we broke 4,000 chats, which was just unbelievable. We didn't come back down. We're still way up there in the 2,000 to 3,000 chats per day, which is just extraordinary and reflective of what's going out there. The second big issue that we're dealing with and you're dealing with is limited testing availability. We are seeing that there are many people that cannot buy kits in their neighborhoods or their neighborhood pharmacies, that there were drive-throughs for picking up rapid kits that were planned by municipalities that then didn't get their deliveries. We're seeing some, I don't want to say price gouging, but we are seeing some price shifting from some of the major retailers that are providing bulk orders and retail. We've heard that both Walmart and a couple of other retailers have raised their test kit prices. We're seeing, and this is really the most concerning thing, we are seeing overwhelmed healthcare and public health systems. A physician friend of mine called me one night last week, practically in tears. She's a pediatrician, and she had a 5-month-old that she sent to an ER. Obviously, she's a pediatrician, felt that the baby needed to be admitted. The baby was triaged and sent home. The mom called her and said, "What do I do?" And she said, "Well, if this and this happens, call 911. That happened, called 911, baby was taken to that hospital ER by ambulance and once again turned away. Fortunately, and the end of the story is fine. She took care of the baby in their office and everything is fine. The same thing happened again the next night with another baby. When this is happening here now already, and we may not have hit the peak of hospitalizations of this, it's very, very concerning. The good news is the hospital admissions are predominantly unvaccinated. The number that I read this morning was somewhere north of 85% of admissions are unvaccinated. With Omicron, they do appear to be getting less severely ill. There are fewer ICU admissions and fewer need for respirators. And we've learned how to treat COVID better with ECMO and some other things. But healthcare systems across the country are beginning to become overwhelmed, and in rural areas where that ambulance, that had alternative hospitals to go to in Norwalk, Connecticut, there are no alternatives in certain or many parts of the country. Yesterday and the day before, there was some fairly high level of panic across our client base and honestly across our families when they talked about this new possible French variant. And the reality is that new variants are coming. It may not be this new French variant, which is named IHU after the hospital where it was identified. And that may not be its official name later on when the World Health Organization gets hold of it, and they did get their samples of it in the last few days. The news today is a little bit less concerning about this variant, but the reality is when we look back over the last almost 2 years, we are seeing surges for every 8 to 12 weeks, and we are seeing new variants following a similar timeline. So it's really critically important that we as businesses and we as healthcare professionals take the lessons learned from this unbelievable surge that was not something that any of us envisioned. At least we didn't envision, 12 months ago or at the beginning of this, and figure out what are the things that we need to do, what are the lessons learned, because the next one is coming. How do we, will this make it endemic? We don't think so, because there are new variants. Will we get to how to live with COVID? That apparently is what the president is speaking about today, and we believe so. Next slide, Jen. We are, by the way, I'm going to try to limit my talk to another few minutes, turn it over to Michelle, and that we leave at least half of the time at the end of this for questions, because you all started sending us questions literally the moment that we announced this webinar. So we already have a lot of questions in our queue, and I'm sure they're coming in pretty rapidly now. So last week, the CDC changed its guidance and said that people who have COVID symptoms, people who are COVID positive, and people who are close contact, unvaccinated, exposed to COVID, could return to work after 5 days. It has wreaked havoc across the business community and across the restaurant community. We were all, the original or the initial response to it was a sigh of relief that it was what many business leaders were asking for. It was released, as you know, in a confusing way. The wording was confusing. The guidance doesn't match. Parts of it don't match what the OSHA ETS says and the guidance related to from OSHA. But it certainly has turned all of our worlds upside down. We are finding our experience, our real life, hour-to-hour experience with your employees is that most employees who get COVID and have symptoms are not better in 5 days. Maybe that was the case with earlier variants, and maybe that was the early communication that Omicron illness wasn't as severe, that it was a shorter onset and a shorter duration. That has not turned out to be our experience or your experience. Our experience is kind of all over the place, but more than 5 days. Our experience is that people may not develop symptoms, not test positive on 1, 2, or 3 rapid tests, and then pop positive at day 5, 6, or 7, and feel very sick then, or have very mild symptoms and then 5, 6, 7 days in develop some more severe symptoms. But we are seeing across your employee populations that many employees, the majority, are not ready to come back after 5 days, and that we need to extend them. Generally, we're extending them by 3 days. At 3 days, we're at day 8, we're often extending another 2 or 3 days at that point, because they're not fever-free, they can't control their cough. It appears that Omicron has GI symptoms that may come later in the illness process. A lot of people in this current surge have GI symptoms, pretty severe vomiting and extended diarrhea, and that is lasting or coming later in the process and lasting quite some time and making people feel very poorly. We certainly can't let them go back to work, and certainly not in a restaurant and food service setting with vomiting and diarrhea. So we're watching all of this. We think that something may in fact happen, or may have already happened with this 5-day, because yesterday's CDC guidance unfortunately added to the confusion. And the statement from the CDC yesterday was that if you can test after 5 days, that you should, and we're really not clear on what that means. I mean, we understand it means you might not be able to find a test, but does that mean you shouldn't go back to work if you can't test? If you can test after 5 days, if you're COVID positive, does that mean you shouldn't go back to work if you can't test, and you don't know that you're negative? And then last but not least, those sort of exposures, there's a lot of question over the last few days as to whether or not asymptomatic people or people early in the process actually are even showing on some rapid antigen tests. We'll link to a really interesting story about that in tomorrow's executive summary from Stat News, questioning the first few days of symptoms and rapid antigen tests. But the takeaway, or the big issue that we are dealing with, that really has our nursing team unbelievably stressed at this point in time, because we're talking to so many of your employees who are ill 2 and 3 and 4 times, not just excluding them for 10 days and then being ready to come back, is that they are quite sick after 5 days. And that 5-day exclusion may have, in fact, make it more difficult to manage businesses. And that's the message that we keep hearing, which is, when it was 10 days, I knew my employees were going to come back at 10 days, that I had to staff for those 10 days or make adjustments to my business operations. Now my general managers are expecting them back in 5, and then they're expecting them back in 8, and they're not getting them back in 8. And sometimes it's easier to manage when you know what to expect and you can adjust accordingly. Last but not least, and this is, I'm sorry, not last but not least, but not of insignificance, is that state and local health departments are not necessarily uniformly embracing the 5-day exclusion timeline. We know that Michigan, New Hampshire, Massachusetts, North Carolina have already said that they're not. I have not been on the news yet today, to be very honest, and therefore don't know if anything else was added to that list today. And as our clients are hearing about other states, they're certainly hope that you'll let us know. But this will be very, very difficult to manage if every state has a different exclusion, or half the states go back to 10-day and others are at 5-day. That will make management of these exclusions extremely complicated. Last but not least in my presentation, the new definition of fully protected for exposures is critically important. And I will say, there was a lot of the CDC changes that I did not necessarily agree with. I don't think 5 days is our answer, because we're seeing people sick beyond 5 days. But what we are seeing across your employee populations is nearly 100% in-home transmission for vaccinated employees who are not boosted. And we are not seeing that with boosted employees. So they changed the definition of fully protected to be 2 doses and a booster. And you can see in some of our documents the various rules that go with that, being more than 6 months from your 2-dose series, being more than 2 months from your J&J or a combination. But we are seeing unbelievable in-home transmission and close contact transmission, but particularly in-home transmission amongst vaccinated families that didn't receive boosters when someone in that household is sick with COVID. So the new definition is certainly causing some confusion. It's causing a communication gap with employees. For those employers that did not get were unable to get a large portion of their employee population vaccinated, we're certainly feeling the effects of that. So just to wrap up, it's certainly been a challenging 10 days. We've had unbelievable cooperation from your employees, your managers, from our client contacts. We've had some good communication with the CDC, and many of our CDC contacts are as frustrated as we are, and as is the American Medical Association. But we are working our way through, and we're hoping to gain more clarity around this. The takeaway for us throughout this has been that no 2 days in COVID have been alike, and that's certainly been the case in the last 10 days. And we don't expect the next few days to be similar to the last. We think there are going to be other changes coming down the pike. Can't tell you what they are, but there are more changes coming. And with that, I will turn it over to Michelle, because the Supreme Court is going to hear the OSHA ETS tomorrow.
Thanks, Roz. So it's an interesting time for sure, especially for those of us who love to watch the Supreme Court and kind of see what they're doing. I thought that maybe it would help to just recap sort of how we got to the place where the Supreme Court is going to be hearing arguments tomorrow. You can listen to the arguments by going to the Supreme Court website. The audio will be streamed live and will also be on their website later in the day. They'll be hearing the two different matters, and we've got them listed here. The OSHA ETS, which is sort of being referred to as the National Federation of Independent Business, or NFIB, versus the Department of Labor matter, and all of the associated cases that go with that, as well as the CMS requirements. And we're not really here to talk about the CMS requirements, but they're tracking along on the same schedule, so it bears mention. And those are generally being referred to as the Biden versus Missouri cases. Those Biden versus Missouri cases, the restrictions, the requirements are different than what we've all been spending so much time talking about. And as I was getting ready to talk today, I was struck by the fact that that OSHA issued the ETS on November the 5th. So we're exactly 2 months from when that ETS came out. And I know that all of you and all of us on this call feel like those 2 months, that feels like a lifetime ago. I was somewhat shocked actually to think that that's only been 2 months ago. But the CMS standard that is under consideration differs from what the ETS proposes, in that CMS is requiring healthcare workers where the providers receive Medicare or Medicaid payments almost without exception to be vaccinated. And there's not an alternative in the CMS for testing and masking options. And so whether you're an employee, a provider, a volunteer in that hospital setting, unless there is a valid religious or medical exemption, vaccine is what would be required. As you all know, OSHA and the ETS would require vaccination, or it would require a negative test, and those deadlines for when these things go into effect have changed somewhat. But the vaccination status and the initial enforcement activities by OSHA are set to go into effect Monday on January 10th, which makes the timing of the Supreme Court hearing this on January 7th really interesting. So on Monday, January the 10th, employers with over 100 employees, and that's broadly defined, will be required to be tracking and knowing if their employees are vaccinated, and there are many, many other things that are included, which all of you listen to Roz and her team talk about a lot. And then on February the 9th, the testing requirements would go into effect. And so unvaccinated employees would be required to be wearing masks, and should be wearing masks now, and would have to be producing negative test results each week on February the 9th. We can talk a little bit about what those negative test results might require as we go forward. So how we got here, OSHA put out these ETS, these emergency temporary standards back on November the 5th, and the very next day, the Fifth Circuit stayed the ETS. And there were a slew of challenges filed all over the country and all of the different circuits. And ultimately, the multi-district litigation team decided that they would do a lottery, and the Sixth Circuit was who was the lucky winner, I guess, as far as who was going to be making decisions on all of this. And so conventional wisdom was that the Sixth Circuit would leave the Fifth Circuit stay in effect on the ETS, but the Sixth Circuit sort of surprised all of us on December the 17th and lifted the stay, at which point everything started moving forward kind of at rocket speed with the ETS and with employers, all of us trying to figure out how we were going to deal with that. The Supreme Court agreed that they were going to hear this, and there have been just so many amicus briefs and things filed with the Supreme Court. And ultimately then at 10 o'clock Eastern time tomorrow, the Supreme Court will hear an hour's worth of arguments on ETS. And then at 11 o'clock, it'll hear an hour's worth of arguments on the CMS case. And then the question is, how long does it take? Generally speaking, we don't expect the Supreme Court to move all that quickly. But what we are hearing is that we could actually learn something as early as tomorrow. And we expect that we'll know something by Monday morning when the initial ETS requirements or the enforcement activity on the requirements are going to start coming into play. And so I think that probably for all of you, certainly for the folks I spend time talking about, that, the question is, what are they going to do? And we've all been on various webinars. We've, I think, probably all been reading, trying to figure out, and there's not great predictions, at least out in the general media. I mean, obviously, we know that we could see the Supreme Court leave the stay lifted, thus allowing ETS and CMS to go forward as is currently underway. But then, they could also put both stays back into effect, essentially stopping the ETS and the CMS, the NFIB and the Missouri march forward, or they could adopt one or stay one and lift the stay on the other, and it could go either way. I think that generally speaking, somewhere approaching 50% think that it is possible that both of the mandates are allowed to move forward. And about a third think that if that doesn't happen, CMS is likely to move forward, the Biden versus Missouri cases, and that the ETS may not move forward. And then much smaller percentages for the other outcomes. And so that's sort of the interesting thing that we are all looking at. The one other thing I thought I would mention, just as we're talking about all of this, is those emergency temporary standards are only allowed to be in effect for 6 months. And it's an interesting question as far as what do the stays that have been in effect do as far as that 6-month time limit running. But the one thing that is worth taking note of is that OSHA is accepting comments right now, because the idea is that ETS would become a permanent standard. And OSHA has extended the timeline for comments through January 19th. And for those who think that it's important to kind of weigh in on whether the ETS and how it's laid out is what is going to become the permanent standard, thinking that that's probably where we're headed, you do have until January 19th to get on. It's www.regulations.gov if you have comments that you wanted to submit for OSHA to be considering as they move forward. So in a nutshell, that's sort of the legal summary of where we are and how we got here and what's ahead in the coming 4 or 5 days. And I think that I will also stop talking so that we can answer questions and chat through anything. And Roz may have some things that she wants to add as she's been following all of this more closely than probably almost anyone else.
So I do have one legal question for you, which is how did the OSHA ETS and the CMS mandates, how did they get linked into a single case with the Supreme Court? Because they're really very different.
And actually they aren't linked. They generally say, when we've been hearing and talking about it, I've been hearing, they were all going to be heard at the same time. When you go to the Supreme Court website, you see that they actually are still tracking them separately. And so they really do have the OSHA ETS as one set of arguments. That's that earlier set of arguments tomorrow. And then the CMS piece is a separate set of arguments. And I think we'll get 2 separate rulings. I don't believe that the rulings are going to be combined into a single opinion.
It seems amazing to me that a set of issues that are this large, and there were so many complications to the OSHA ETS, and the fact that the vaccine mandate and testing requirements were linked, that makes it all so complicated, and testing availability and the surge magnify all of these issues. 1 hour hearing oral arguments feels unbelievably constrained.
Very
constraining.
Right. I suspect that the folks who are there and who are making the arguments will feel like that hour lasts a really long time on the one hand and flies by on the other. One of the things that I looked at getting ready to come and talk to everybody today was just sort of how this all lines up and what's expected as far as who to pay attention to if you're listening in tomorrow.
Oh, and what's the answer to that?
So the general thought is that you've got kind of 3 sets of 3. You've got Breyer, Sotomayor, and Kagan, who everyone believes will be on the side of lifting any stay, not putting a stay into effect, and allowing both of these programs to go forward. And then you have Thomas, Alito, and Gorsuch, who people generally expect to say this should be stayed. There are various reasons, different issues on the merits that ought to be considered before the programs are allowed to go forward. So the idea is generally that you should be listening to Roberts, Kavanaugh, and Barrett and that those are the folks whose questions will give maybe hints of where things are headed, or signal some of the concerns and thoughts that we'll be hearing more about.
And then yesterday, we both heard some things about merits. And if the question comes down to merits, then it goes back to the Sixth Circuit, right?
That's right. That's exactly right. So although the reality is that in order to decide if they are going to allow a stay to go forward, lift a stay, really, I think those merits get considered generally, and you know, it won't be the fuller opinion that we will ultimately likely end up with here, but they really will get to the merits, and you know, they're nerdy constitutional law things like the major questions doctrine and the non-delegation doctrine, and you know, was there grave danger as is considered under the OSHA Act, or you know, is there a concern about every employer? Does every workplace have to have a concern about infection, or is it enough that it's more the broader public question? So I think that what we will see is that they really will get to some of those questions, even though that's not the purpose of tomorrow's hearings. We sort of got a preview of that in the case where the Supreme Court denied the injunctive relief that was being requested, where the healthcare providers in Maine were asking for a stay because there was a question about whether or not a religious exemption should or needed to be included, and was not. And although the decision not to allow the injunctive relief was very brief, the dissent went through a lot of the merits. And so I think we'll see some of that tomorrow and in the rulings as well.
Well, and the timing certainly makes consideration of the merits complicated. You know, that we are, you know, that we're seeing, you know, potentially 5 million new cases a day in the healthcare system, you know, hitting capacity. So it's certainly that has to have an impact on what they're hearing tomorrow.
And I think one of the things that's been interesting about it is that question of grave danger and sort of the need for an emergency approach to dealing with some of this. And people are saying, oh, well, you know, it's been around for a couple of years now. Is it really an emergency? But even with Delta before Omicron, even with Delta, you know, things had changed in the vaccines, and you know, are they lasting? Are they not? Do you need a booster? Are we going to need a fourth shot? You know, a second booster? And so all of it really is unfolding every day. But those are all things that I think we're going to be hearing. You know, you talked about the hour oral arguments that we'll be hearing. When you look at the website and see the number of amicus briefs and just the sheer volume of documents that the justices and their teams are having to get through to get ready for tomorrow and then to issue these rulings, it's really remarkable.
Oh, well, thank you. So Jen, I imagine you have some questions.
Yes, we do. We have some great questions already. Thank you both so much for all of that. Great information, great discussion. So I think we've got a bunch of different questions. While we're still on the topic of tomorrow and the Supreme Court, we have a couple of questions around states that have a state plan as opposed to federal OSHA. Michelle, could you speak briefly about what states with a state plan, how they'll be affected?
Sure. One of the deadlines that is in play right now is actually tomorrow as well. And that tomorrow's the deadline for states that have a state plan to announce whether or not and how they're going to come into compliance with the federal plan. And so there's sort of a separate timeline of events for those states, but about half the states have their own plan rather than being federal plan. And generally speaking, and this is a pretty common thing, if the state's plans are more restrictive than what the federal government has, they're likely to be allowed to go forward, but they must at least accomplish the same things that OSHA is trying to accomplish at the federal level. And there's that deadline of tomorrow for the states on the state plan to be making that announcement. And then later in January, they have another deadline where they have to submit the information as far as how they're going to do that. And so it gets really tricky. I know for a lot of the people on this call where you've got locations all over the country and all of these varied programs, as is typical, California's state plan probably is more restrictive. There are more requirements in what we see with the Cal OSHA plan than even what we see with with the OSHA ETS. But that's generally how that will work.
Great, thank you. I'm going to stick with the OSHA questions that are pouring in for a minute, and then we'll switch over to some of our many clinical questions that we have for you, Roslyn. Another question for you, Michelle, around this, which is, do you expect that they might change the date? I know that there are some looming deadlines coming up next week. They're hearing them tomorrow. Do we expect that they're going to change the date, either in response to the fact that they're hearing the case tomorrow, or also the fact that there's this shortage of COVID tests, which are required for the second part that will go into effect in February?
So I've not heard, and Roz, I'll be interested to hear your thoughts on this too. I have not heard any suggestion that anyone really anticipates if they don't put the stay back into place on one or both of these. I've not heard suggestion that we expect that the court would sort of come up with its own set of dates. I suppose that there's a world in which they could tell CMS and OSHA, or CMS or OSHA, to come up with different dates. But I've not really heard any rumblings about that. And certainly I know that 0 Hour has been telling people, get ready for that January 10th deadline. That's very consistent with the advice that we've been giving our clients, both in sort of the employment setting and just general counsel type ideas, is to, anticipate that those dates are going to stay firm. I think that what you just said, Jen, is really very accurate as far as the shortage on testing and just what is a negative test. And Roz and I talked a little bit about this at about 5:30 yesterday morning, I think. What is a negative test, and what does a proctored test look like? Is an app on your phone that says it was you that did the test, does that count as a valid negative test? And those are questions that I don't, that we're not going to get answers to tomorrow. I'm sort of leading us far astray, but those are things on the horizon. I think we're all going to have to be ready to be talking about in very short order, because there is such a shortage of tests.
I think that OSHA, and I may be not giving you the exact quote of what it said in the OSHA guidance, but a good faith effort towards compliance was clearly stated in almost those words.
That's
so, right. There are lots of businesses out there that are just starting to find out which of their employees are vaccinated or not, that haven't started their vaccination tracking or communicated it out. That are just starting to look for purchasing tests for next month. But a good faith effort in our advice, and it's not necessarily legal advice, but partially this is all very complicated and we all have a lot of moving parts, is keep track of who you're, of what you're doing, document it all, of what you've done looking for tests, of who you've contracted with for, or who you've met with to implement your vaccine tracking, so that you can show your good faith effort. And again, that's not legal advice. I'm not the lawyer here, but that's what we keep hearing.
Great, thank you. So that's leading me straight into the kind of clinical question that we're getting in 1,000 different ways, which is basically, we know that many of our clients, many people on this call, have employees who are not going to be vaccinated by the time the ETS kicks in. What advice do you have, Roslyn, for someone trying to run their business who is struggling either to deal with how to either have employees get their own tests or how to proctor those tests on site? What are some of the best practices? What would you recommend for someone who's trying to figure out how to do this?
Well, that is the million or even $billion question. And getting hold of tests has certainly been challenging. We have found availability has eased up somewhat on the bulk level, and that there are some different channels, and that there are some newly approved FDA emergency use authorization kits, and that there are different channels for getting tests than there were. Some of our clients have used a best practice of having employees show up for work on the day that they need to be tested, handing them a test kit, having the employee administer their own kit, whether it's inside their business or their restaurant or outside, leaving the test, either keeping the test and keeping it with themselves outside and coming in and showing the completed test to their manager, or leaving the test with the manager, them going to work and the manager going to get them, or the testing coordinator going to get them if they were to test positive. We have a lot of concerns surrounding the actual testing process because the people who are being tested are your unvaccinated employees, and those most likely are at highest risk for COVID. So we want to be sure that you build practices that don't place your managers or your testing coordinators at higher risk. So certainly, it is January 6th. It is very cold out here in New York. And in Connecticut, and there are parts of the country where it was much colder. Yesterday, there was a situation that took place in Vermont with regard to exposures and trying to limit exposures amongst a group of high school students. And it was 2 degrees when it happened. And they had to make a decision as to whether or not to risk close contact, with a lot of students versus frostbite, and they chose close contact. Those kinds of issues come up, or those kinds of situations are relevant to how we coordinate testing. So we don't yet have an answer. I don't know if you can see behind me, but I have a whole lot of tests, different kinds of tests here. And there are 2 of them in particular that have a very good app, the BD Veritor, which is somewhat difficult to get and more expensive, the Quidel Quick View at Home. And then I'm going to tell you a couple of different things about these. But there are a number of test kits out there that have an app where you can choose yourself as the user and then email or text your result to your manager. We are really anxious for a ruling from OSHA or from the agencies that are requiring this as to whether or not that's acceptable, because that would be a better way to do this than the ways that we are currently doing them in certain workplaces with employees testing in the workplace or outside of the workplace. Is there room? We have a lot of concerns in Zero Hour Health and Zedic about testing, all about testing. We noticed a day or so ago that we saw the same picture of a positive test from multiple employees at one location. And they were not creative enough to use different backgrounds for the test, and it was a distinct background. And the same nurses got those. So I realize I'm not giving you a direct answer, and I'm kind of going offline in this, but best practices are, I think you're going to need to have at least 4 weeks supply of tests, and you're going to need to know how many employees are vaccinated and who aren't. We are seeing excellent improvement in vaccination rates when mandates go into effect across our client base, and that you will probably need fewer tests than you think. Our experience has also been that once we start, or you start the testing process, it's difficult. It's time consuming. It may be a little embarrassing. We've had employees say they don't want to stick things up their nose in front of their boss or their coworkers. As simple as that. That may drive people to go get tested. Go get vaccinated. And this surge is driving some people to go get vaccinated. The pattern that we've seen this week that is really, really challenging to business operations are the same unvaccinated employees getting excluded multiple times for close contact. And how we can continue to run the business community with those employees being unvaccinated and continuing to be out over and over again is really going to continue to prevent us from getting to the end of this and getting back to business. So again, a convoluted answer to the question, there is no easy single solution. It's really good to find out what other people in your space are doing, testing on site. The proctored tests are very, very expensive. There are certainly tests where you could purchase telemedically proctored tests. They are cost prohibitive. There's no question about it. I was asked one other question, Jen, and I don't think this is necessarily part of the question that you posed, but are employers paying for tests? And it almost uniformly right now they are. Employers are concerned about losing their employees to another employer if they don't pay for the test and the other employer is. With that said, as we continue to see free testing more and more available in communities, it may be that we get to a point that an employee brings their own home kit, the kit that they got to work and proctor it in front of a manager or a testing coordinator. Long answer.
Great, thank you. Useful though, really useful. Okay, we have lots of questions in here. We might not get to all of them. We're gonna do our best to do that. One of the questions that we have is we're getting, well, actually sticking with testing while we're on the subject, but switching over to you, Michelle. Any guidance on what record keeping should look like, on how keeping the results of COVID tests, like how long they should be recorded and what the employer's obligations are there?
I don't know the answer to your how long they should be maintained. Generally speaking, I think that, there's sort of, I guess, a couple of ways that that's happening. We're talking about that in our own office right now. And so I can speak even just to our own conversations. And certainly there is protected health information that is in play here. And so keeping the information in a place where it is completely separate, and this is legal best practices, you need to keep that health-related information separate from the general employment file. And it needs to be in a secure way where it is accessible by the fewest number of people that have really valid reasons to be accessing it. The question is, are you better off to do it yourself or to do it through someone else? And we're looking at that right now, trying to figure it out. I mean, we have PHI on people all the time, given the areas of practice that our law firm works in. But we are really seriously considering outsourcing all of that information. And so whether it is the daily conversations about symptoms, or if it's the vaccine results the vaccine records and knowing who's vaccinated and who's not, and then extending to the negative test results. Certainly it needs to be in a password protected, safe place with limited access. I mean, I think that's sort of the best advice. And then generally, I would say it would depend, and we've got employment folks who answer these questions all the time, but if there are state requirements for how long various employment records are supposed to be maintained, I would say for now, this is not going to be taking up a lot of space or effort, and so it's better to keep things longer than shorter. We generally have maintained things that we've been doing since about the beginning of when we started tracking all of those records. We haven't started to try to go through and get rid of the older data yet. But I think we'll probably all get some guidance on that as we go forward here.
I was just going to jump in with a quick comment on that. When we designed our zero-hour Zetic vaccine and testing tracking system, and I know you guys have seen that in Messner, we went with the assumption that we needed to be able to manage that data the way that we do OSHA hazmat exams or other kinds of pre-employment physicals that are required under OSHA, which is sadly the length of employment plus 30 years. And we were trying to get a read other than that on this data, and we could not get one. So when we designed our system, we made sure that we compressed our data, we have our data stored securely, we have it backed up in many ways, because it may be length of employment plus 30 years if they don't give us other guidance. And that is daunting.
That is daunting.
Mm-hmm.
Another reason that we've been chatting with you all about how to maintain that for ourselves on your systems.
Great. All right, switching gears a little bit. We have a lot of questions about some of these new CDC changes, what they mean for employers. One of the biggest ones we've gotten a few different ways, which is, how should we be handling it if you are operating a business in a state or in a local jurisdiction that isn't following CDC guidelines? Whose guidelines should you be following? And Roslyn, I'll kick that one over to you.
We have always understood that it's the state guidelines that you need to follow, unless the federal guidelines are more stringent. Michelle, is that how you'd read it?
That's exactly what we would do.
Mm-hmm.
And even going down to the county level, because I know in a lot of states, there's a significant variance, even just county to county or municipality to municipality. But
Michigan,
certainly Colorado, actually, interestingly, has quite a wide variety of guidance from different departments. And so generally speaking, I think the more stringent guidelines are the ones you're going to want to be following.
Absolutely.
And Michigan has side-by-side counties. So employees may live in one county and work in another, and some of them are at 10 days and some of them are at 5 days. So
yeah.
Real challenges. As someone who works very closely with ZHH's clinical team, I also want to point out that there are certain doctors, healthcare systems, clinics that have not yet updated their guidance. And so certainly from our clinical team's perspective, we'll tend to go with whatever the doctor says. So if there's a doctor's note that says 10 days, we will generally defer to the doctor who may have more information than we do. But it does mean that there is a huge variation in individual employee exclusions right now, based on the doctor, the county, the state, and CDC regulations. So,
and there's my little plug right there. We realize that's confusing for your managers, but what we do hope the message to your managers that you take back from this webinar to your managers is please trust that our clinical team knows the exclusion guidance and is doing the right exclusion for your employee, unless it is different in your jurisdiction. But if we give someone 8 days or we give someone 10 days, there's a good clinical reason, and that we don't have the bandwidth to litigate each one. Did I say that politely?
I'm sure our nurses will be delighted to hear that plea. Great. So a couple more questions around the ETS that are coming up. We have some different ones. I think one that's a couple that are interesting is, are we seeing restaurants actually going ahead and mandating vaccination beyond OSHA, not necessarily, vaccine or testing, but going ahead and doing a blanket mandate? Are we seeing restaurants or other businesses besides airlines, which are the big ones in the news, that have done that in healthcare? Are we seeing people do that, and what's the outcome there?
Great question. The answer is yes, we are. We are seeing employers across various industries mandating employee vaccinations as a way to save their businesses or a way to find their way forward. Some of you may have heard Mark Hinson from Bar Taco on one of our podcasts, where Mark talked about Bar Taco's vaccine mandate and how they communicated about it and how they retained their employees and how it became a way that they became a very safe place for people to work, or the perception that it was a safer place to work. We certainly saw that across New York City, where there was a vaccine mandate that already rolled out. We are seeing that vaccine mandates work, that they help employees feel safer, they help your guests feel safer, and they reduce the incidence of COVID when their employees are vaccinated and boosted. So the short answer to the question is yes, we are seeing more and more mandates. We hope to see more mandates no matter what happens with the ETS, because we believe it may be the only way forward at this point. So thank you. Good question.
Yeah, and a follow-up question to that. If employers mandate vaccination as part of their policy, and then the ETS does not go through, could they pull back on the new policy? I believe that's a question that Debbie's posing here. If they issue a mandatory policy and it doesn't go through, can they pull it back?
That's a very specific legal question. There's a really interesting article in today's Society for Human Resource Management newsletter or magazine that came out earlier today, that talks about implementing vaccine mandates and employer guidance for it. And that might be a good choice. I know, Michelle, it's hard for you to give direct legal advice, but feel free to weigh in.
Yeah, no, I mean, I think it is. It's a tough question. And I think it is going to require some specific legal advice, because you're going to want to know exactly what that policy was. I think you're going to have to be thinking about what the impact of pulling it back is going to be on new employees. Is there going to be disparate treatment of employees? And so I think that there really will be the need for some pretty specific advice when trying to change from a more restrictive policy to what could potentially be considered a less restrictive policy.
To your point, the way some of our clients have rolled out vaccine mandates are to communicate that there may be or there is a vaccine mandate coming, but to implement a vaccine requirement for new hires, and that has been extremely effective.
Interesting.
Great. So we have a really great question from Julian that I want to make sure that we discuss, which is around these CDC changes, in particular around shortening 10 days to 5 days, which is, is there a message that managers can take to their employees showing that reducing this quarantine and isolation is relatively safe, and that they're, and kind of basically how can we assuage employee concerns about shortened isolation times? Roslyn, you want to start with that kind of tough, tough question?
I will, and I'm not surprised that I get a very good and very challenging question from Julian, and I'm glad that it's during the day, but because usually we're having these chats later in the evening. So that's a really good question, and it is very difficult to assuage their concerns right now. In part, when the American Medical Association comes out against the 5-day from the 5-day guidance, and Dr. Fauci made some kind of statement about that we might need to evaluate it. And then the CDC came out with this additional guidance that said maybe you need to test at the end of 5 days, and tests may or may not be available. So it is very, very difficult to assuage employees' concerns. What we have communicated and what we communicate to your employees we are following the CDC guidance, which is based on the best scientific evidence that they have, which we may not have a full window into. But what we know is that all of COVID is most infectious in the 2 days before onset of symptoms and the 3 days after. So that if at the end of 5 days you still have symptoms or you are still testing positive, we know that you are much, much less likely to be transmitting it. And that would be the message, which is we know 2 days before, 3 days after, either onset or testing positive are the times that you are most infectious. We keep getting employees chatting into us and saying, I have new cough, fever, loss of taste and smell, shortness of breath, but I haven't been around anyone with COVID. We probably see this without exaggeration 500 times a day or more. I haven't been in contact with anyone with COVID. Everyone has been, but everyone hasn't gotten COVID. So there are some good guidance that 2 days before, 3 days after, and really encouraging everyone around you to isolate when they have COVID, because there have been a lot of news stories in the last few days about people not quarantining or isolating when they have COVID symptoms or have been exposed. But good question.
Yeah, great question. Thank you. Excellent. So with a couple more specific questions. Hopefully we can try to get to most of these. Quick one for you, Michelle. Do OSHA ETS rules apply on Indian reservations?
Ooh. I saw that question. I peeked into the chat room for a second, or to the Q&A, and saw that one coming. And I did not go and look it up, but I believe that I read that they do not apply on reservations. And so if you all have heard something different, I would love to hear that. But I actually saw that on something I was looking at today, did not pay enough attention to be able to answer this question with certainty, but I do not believe so.
Great. Thank you. Another one for you, Michelle, which is so a question around why the 100 employee number applies the way that it does. Why it doesn't consider multiple work sites. So the question is, one building with 100 employees is being seen the same as, 4 restaurants with 25 employees each. Any insight into why that's the case?
The insight that I've seen and that I've heard is that in large part, the goal was to capture as many employers as possible. And the idea being that if you have 4, although your revenues would be impacted if you've got 4 different locations instead of 1 larger location, you still are going to have the more significant revenues that should remove some of the burden from having to comply with the ETS. And so that's just the general sense has been just that idea to try to capture as many as possible. I mean, the guidance is that if you have 25 employees that work on site and 75 that don't come in, you still have 100 employees. And so how you count heads is very broad, and I think is intentionally done that way to extend to as many businesses and employees and employers as possible.
Great. And last ETS question that we have on here so far is just, I think this gets back to what you were speaking of earlier around any grace period based on testing availability. But again, someone is asking, that, vaccine tracking companies sometimes have long startup times, sometimes there's big overhead costs. And they were wondering whether any of the deadlines might be pushed back. I think we answered that question a little bit earlier. But I think the kind of modification that I would make to this question is just, if companies are actively pursuing, starting vaccine tracking, starting to buy tests if they're going to provide it for their employees, things like that, do we think that generally will be considered kind of within the umbrella term of best effort for OSHA, or that be considered good enough to avoid an OSHA fine? I think is the real question. I mean,
so I'll take a stab at that, and then I think Roz is probably going to want to add to it as well. I think that it's the devil's always in the details, on that situation. And so are you calling and interviewing various vaccine tracking providers right now, trying to figure out what you're going to do and doing nothing else to be tracking things yourself? You know, my sense is that's probably not going to be considered sort of a best effort or best practice. You know, if you are interviewing those providers and keeping track yourself and keeping them in a safe place, I think that's going to be received a whole lot better. I think that we'll see a fairly long ramp up, particularly for smaller businesses and smaller companies. You're not going to end up, hopefully, on OSHA's radar quite as quickly. But generally speaking, it is going to be kind of, what does that look like? What does that preparation and that ramping up mean? If tests aren't available, you know, that's going to be one question. But keeping track of vaccine status of your employees, if you're not using a service to do that, is something that, at least arguably from OSHA's standard, I think they're going to say, well, even if you're not using a provider, that's something you could be doing on your own and continuing to move us down the continuum of what we're going to be requiring you to do.
I think that sums it up well. I think, again, they're looking for a good faith effort, you know, so for if you've contracted with us or someone else and you're not fully up and running, but you have a timeline, or you have the process is moving forward, we think that will meet OSHA's intention. I don't think their intention is to go out and find a lot of people very quickly. Their intention is to get people to get vaccinated and or tested, but really to get vaccinated. So, you know, that's where we've been focused.
Great. All right, we have just 2 more minutes left. I think we can squeeze in one last question that just came in, which is, you know, how, for Roslyn really, which is like, how high are these positive numbers really that we're seeing everywhere? You know, we're hearing that over 1 million people tested positive in a day. Do you think it's much worse than that in reality?
Yes, we do think it's much worse than that. We are seeing a lot of people that are not going to get tested. They're not even bothering because, you know, their family member went and looked for kits and couldn't find it because they're too sick to go out and look for kits, because they went and got a PCR, but they didn't. The results are taking not just 1 or 2 or 3 days for some PCRs. There are places that are taking 7 and 8 days, you know, or they're not, you know, not even getting their results. So we do believe the numbers are much higher. And we think those are reflected as the hospitalizations are continuing to climb. But, you know, we've heard numbers of maybe there's another week or 2 to this surge, to another 5 to 6 weeks of this surge. It's hard to tell, you know, which of those estimates are accurate. But we do believe the number of positives, the number of current cases, is significantly higher than the published numbers.
Great, thank you. With 1 minute left, any final parting thoughts from either of you?
Other than to share our contact info, so if people have follow-up questions or they want to see our vaccine or testing tracking, if you would put that information up. I don't mean to say that this all sounds like doom and gloom. I think we've learned an incredible amount in the last 20, I guess almost 23 months, you know, hitting quickly towards 24 months, and how to manage COVID. And how to keep sick employees from working. We think that, you know, many of the things that we've learned over this time on how to keep restaurants safe and following good food safety practices and good employee health practices continue to work, and they become natural for us. You know, things that we, you know, talked about, you know, we talked about hand washing for years and years and years, and you know, we have people back focused on it. So I don't mean to make this all sound like it's doom and gloom. There are a lot of people sick out there, and there are a lot of people very sick. But it's also a success story of how we've adapted, how we've built better health practices, how we will continue to do so, how we have miracle vaccines that really do work in preventing people from dying. And, you know, we will get through this. Michelle, do you have a parting
No,
word?
I think that was really well said. You know, you started this by saying, and I guess I'll end it by saying, I know more people right now that have COVID. Some family members who have been hospitalized in the last week or 2 and had not experienced that throughout sort of the 23 going on 24-month period. Like you, I think that I probably know more people today than cumulatively during that entire timeline. And so the direction that we're headed, whether it's because of ETS or what we have learned and getting people vaccinated, I think really is making all the difference. And I think that people are starting to have a little more faith in some of the science that underlies all of this. And we're hearing a little bit more of that even, in a law firm setting. So hopefully that carries across for all of you.
Thank you.
Great. Well, thank you so much, Roslyn. Thank you, Michelle. We are so grateful for both of you. Thanks for all of this fabulous information, and thanks to all of you who joined us today. We really appreciate it. Any questions, our contact info is up on the screen, and we are very grateful to have this great resource for us as we navigate all of these changes. And we'll be watching very closely, listening very closely tomorrow. And I'm sure we'll have lots of updates for you after tomorrow morning. So thank you so much.